Afternoon, Saunders County. It's Dr. Akers just coming to you from Saunders Medical Center for your daily update regarding the COVID-19 situation here in Saunders County. So today is Tuesday, April 14th. The most recent press release from Three Rivers Public Health Department states that there are 6 confirmed cases in Saunders County. Now, those are individuals that have actually been tested for the virus and have come back positive. Keep in mind, though, that some of their close contacts may also be exhibiting symptoms but don't require testing so that we can maximize efficient use of our testing supplies. So that number may be plus a few extra people within the county. We do not have any recorded deaths though at this time. So you may have seen that Dodge County and Washington County did have their first deaths related to the virus. Unfortunately, we kind of expected this to happen as the pandemic hit Nebraska more. I still think, though, that we're doing a really good job of trying to socially isolate, maintain good hand hygiene, maintain social distancing, and that will help to minimize the spread and minimize the number of deaths related to this virus. All right, so again, with regards to the virus, if you are having symptoms, but they're more mild symptoms, we want you to stay home if it's safe to do so, but we do encourage you to call so we can give you some guidance on what to do for the infection. One thing that has come out to be very beneficial is actually self-proning, and what that means is that when you are at home, we recommend that you lay on your stomach for about 15 minutes every couple of hours is what most of the research is showing. If you look online, there's different recommendations on how to properly do this. They may recommend laying on your left side and then your stomach, then your right side. In all honesty, I think if you lay on your stomach 15 minutes every couple of hours, that's going to help quite a bit. And the reason for that is you're recruiting alveoli, which are the little bubbles within the lung that help exchange oxygen and CO2. You're opening more of those up to help with your breathing. And so by doing that at home, that's a way that you can help with your lung function, help with the cough, and help minimize the shortness of breath. So that is a really good tip for something that you can do at home if you are experiencing symptoms consistent with the coronavirus. I also would like to remind you all that we are still seeing well patients. Obviously, we're trying to minimize that, to minimize the foot traffic at our facilities, but there's certain situations where we do really want you to stay on track with your well checkups. And the most important one is for those young kiddos that are due for immunizations. Again, if we fall behind in those immunizations, that can lead to other problems. So we have a whole wing of our clinic that's dedicated to the well visits. So we keep it nice and clean, no sick patients there, no one that has any symptoms of coronavirus. So just know that we do encourage you to still schedule those particular well child checks, especially if they require immunizations, to make sure that your child is on track for those visits. If you have any questions with that, you are always welcome to call our office. Our contact number is 402-443-4191 for the main line, and then you can talk to registration with regards to when to schedule that visit to help to make the visit, but to also keep you guys safe. All right, and then the final thing I'd like to discuss today is the CDC does recommend that when you are out in public, especially in a place where you cannot maintain adequate social distancing of 6 feet, they do recommend using a cloth mask, and I have an example of one. So we've had some member of the community making these masks for us for when we are out in public. We're trying to minimize going to the grocery store if we can, but obviously things happen. You need to run to the store. So in that situation, we have these cloth masks. So it's different than our surgical mask that you'll see us wearing when you come in the office. This is a mask that we wear that slips around our ears to minimize droplet contacts, but it's not as good at filtering as the device called the N95, and I'll show you an example of that. So if we have someone that is high risk for coronavirus, you will see us wearing this mask that goes and loops around our head with a surgical mask on top of it. Otherwise, if you aren't having symptoms, we will still be wearing this kind of mask, and that is a policy that our facility is doing facility-wide, that you have to have a mask on when an employee is working in the building. But when we are out in public, the CDC recommends at least a cloth mask if you are not able to maintain that social distance. Primarily, this would would apply to the grocery store where you may be interacting, passing people, or having to check out. And the reason for that is this cloth mask does a great job of catching large droplets. It's more so to protect you from spreading an infection if you were, say, asymptomatic, meaning no symptoms yet of the virus, but may actually have it. So I don't think anyone would intentionally go out in public when they're having bad symptoms. So I think it's more for those people that are asymptomatic, but it would still to help catch a lot of those droplets to minimize spread of the virus. So that's why the CDC is recommending it. They aren't saying that you need to have a surgical mask like we wear in the hospital. This is because we are examining patients, we're dealing with droplets, and talking to people in a very close proximity. So that's not something that they necessarily recommend. They want you to save those for the healthcare workers that need them. But these cloth masks are a great way to protect yourself and protect others. So I'll show you that these have been hard to find the elastic. So if you need to use a cloth, like a ribbon, and tie it around the back, that's fine too. The goal is to try and get a good seal around the nose. And then you can loop it on and go to the store. You can see I have a nice tiger print to this, so you can make it whatever print you would like, make it fun. I do think Carol did it, by the way, and that's really all I have for you guys today. So if you'd like to drop any comments, we appreciate your feedback, and we hope that you guys are staying healthy. We'll get through this hopefully sooner than later.